Hello, everyone. Welcome back to Regional One Health Lunch with Dr. Coopwood podcast. It's exciting to be back. We took a 12-month break because of the pandemic and our social distancing policies within the organization. But with the better control, the vaccine, and all those good things, and the ability to do some social distancing here in the podcast room, we're able to get things started together. And today we're going to talk to Mr. Ambro Johnson and Miss Lilly Cooper as our guest today to introduce you to the organization, to learn a little bit about your philosophy and learn a little bit about you. So we're going to start with Mr. Ambro Johnson, and you are a daytime supervisor for environmental services.
Yes.
And how long have you worked here at Regional One Health?
I've been here at Regional One Health for, it'll be 6 years in June now.
And that's exciting. So you've seen a lot of changes.
I have.
And you've seen a lot of opportunities, but nothing like we saw in these last 12 months with the pandemic.
Correct.
Tell me a little bit about we think of essential workers. We first go to the nurses and the doctors and respiratory therapists, and we think that's the essential workers. But EVS is an essential worker for the hospital on a day-to-day basis, and extremely important during the pandemic. Tell me a little bit about how it affected EVS.
It was rough. EVS, we put in a lot of plans in place when the pandemic hit. What we do, EVS as a department, we sanitize and disinfect the facility. That includes OR rooms, patient rooms, hallways, restrooms on a daily basis.
Very good, and that helps people put in perspective the essential function of EVS. If EVS walked out of the hospital and said we don't need EVS, the trash would pile up. The organization would immediately see the effects of that. And so, from a leadership standpoint, I just want to say thank you to you and your team for doing that work that keeps us safe, reduces infections, and is part of the team in helping our patients get better.
Thank you.
This whole pandemic was a emotional time, an emotional experience.
Yes.
Tell me a little bit of how you work with your employees and how you motivated them to work through this, because there was fear of catching the virus. There was fear of dying from the virus. But to motivate your employees to continue to come to work and be a part of the solution, tell me how you were able to do that.
My leadership team did a great job educating us, and we educated our employees. We let them know that their job is very important. Without them, the doctors and nurses won't be able to do what they do, and hospital won't operate accordingly. So everybody was scared. We had employees to leave. You had some employees that want to go into COVID areas because they want to educate. So we educated them on a daily basis, and we let them have their open concerns, and and that was the key part of communication.
So yesterday, I didn't realize that I hadn't looked at my calendar for the next day. We did a tour yesterday with you and your team. And we walked around and looked at areas, and I was impressed with you all's team to be able to see, and it kind of goes into our next question when we talk about patient experience. And we all do this at home when our bedrooms or beds are made up, but there's a pile here, there's a pile there, there's a pile there. But when company comes, we look at it a whole differently.
Correct.
Whoa, we got to pick all this stuff up because company's here. And when we look at the whole organization, we always have to see it as if company is coming. And so when we put together those plans, it's kind of what we discussed yesterday, is that we always see the organization through the eyes of companies coming.
Yes.
And when we do that, we're motivated to make sure the floors are popping and the trash is always emptied. And I just had a good time walking around with you all yesterday, and I appreciate you all putting up with me, and hopefully it wasn't too bad to walk around with the CEO. So how do you educate? We talked a little bit about education. How do you educate your staff about patient experience and what EVS plays in that patient experience?
Good training, for one, good training, and we do follow up behind them with discharges. We do what you call a swab culture, to which you swab the room to make sure there's no disinfection inside the room. We make sure they are doing what they need to be do. We have a plan for them to do each and every day, starting with high-touch services all the way down to low-touch services. And that is very important to us, because when a family member or a patient comes in to the organization, to the hospital, to a room, if they smell bleach, if there's no trash in the room, if the floors are popping and the linen is immaculate, they say, the hospital cares about me. Same with the visitors. The hospital cares about my loved one, and it's very important.
It really is, and for you as a supervisor, you got to instill that into the people that you work with,
Yes.
that work under you. Because a lot of times, if you just see it as a job, I got to mop this floor, I got to wipe this down, and you don't do it in a way that is thinking about what is that patient's family going to see and
Correct.
feel. And so you have this extra job as a supervisor
Correct.
to motivate me if I'm working for you.
Right.
Hey, Mr. Coopwood, we really got to get this room popping, because we have a 45-year-old male who's coming in here for some kind of, been in some kind of traumatic accident, and we really want this room to look good for him.
Right.
And then I'm now invested in being a part of that patient experience. So that's good. Right. So what do you think are your biggest challenges that you may anticipate going to the next year?
To make sure my housekeepers, my employees stay motivated. And I do that in a huddle. In a huddle, I tell them, you have to love what you do, first and foremost. You have to love what you do. I love what I do, and my employees love what they do. So you love what you do, you put into what you love. And so I let my employees know this could be one of your family members in hospital.
Mm-hmm.
You want to treat them as same as you would your mother or your sister. You want to pour the same love. You want to do your aided. You want to make sure they're getting taken care of, sanitize and disinfect your room and your bathroom each and every day. So you have to love what you do. I love what I do. They love what they do. We keep them motivated like that.
It's important. That's the difference between kind of a job and a career, or a job
Right.
and a when you feel part of the team,
Right.
where there's a story of Dr. DeBakey, who's a famous heart surgeon down in Houston, and he was making rounds, and they asked the gentleman who cleans the OR, and he says, "What is your role?" He said, "I'm saving lives,
Yes.
and helping with the heart transplants." And they're like, "How do you do that?" And he said, "Well, my job is to make sure everything is clean and sanitized and germ free, so that the next group of important people that are no more important than me, but the next group of important people who come in can do their job."
Yes.
and operate on the hearts. And so that's what we desire for all of our employees throughout the organization, but definitely in EVS, because sometimes people tend to want to look down on EVS, but
Yes.
EVS is as, if not more important than so many
Yes.
other things that happen in this organization. So thank you for your leadership.
Thank you.
Work is important,
Yes.
but so is family. So is life outside the hospital.
Yes.
So is that balance.
Yes.
So tell me a little bit about your what you would like to share personally, about your personal goals. One thing I learned in this pandemic, and as I watched and had a few people that I knew that passed, that nothing's guaranteed, and so I can't work 18 hours a day and ignore my family and say I'm gonna get to them later.
Exactly.
Later, for a lot of those people who were affected by COVID and affected by trauma, doesn't come. And so I hope that you're able to keep that work-life balance So tell me a little bit about yourself and so people know who Ambro is, not just the guy who walks around looking to make sure the trash is picked up and the house is clean.
Okay, I will be celebrating my anniversary, which will be 5 years in October.
Congratulations.
My wife works second shift, and so we do miss each other a lot, but we try to balance it on our off days. I have my dealer's license. I like buying used cars. I like selling used cars when I can afford it. So I enjoy that. I love coming to work, do the best job I can while I'm here, and that keeps me going right there.
Well, I just want to say thank you for all that you do on behalf of Regional One Health and our patients. You are very important to this organization. The people that you manage are very important to this organization. And if you're watching this podcast, make sure you congratulate Ambro and his team for what he does to help us be a team that's taking care of Regional One Health patients. Thank you so much for your.
Thank you for having me, sir.
Absolutely.
Thank you for having me.
Our next guest is Ms. Lilly Cooper. She's a director for the Route Center, which means she oversees our nursing teams and the women's services and our NICU. So welcome, Ms. Cooper.
Thank you.
Good to have you. You overlook a whole lot of different specialties, and you take the opportunity to celebrate your team's wins. Tell me about the teams that you lead, and what are you responsible for?
All right, so they're my joy, my love, my team. So in Route, the building is named after a previous mayor, right. Mr. Route. And we have 2 centers of excellence in Route. We have a level 3 NICU, neonatal intensive care unit, and we also have a level 3 obstetrics, high-risk obstetrics. So those are both 2 centers of excellence. Within that, we have an OBED. We have 3 operating rooms. We have 15 private labor suites on our labor hall. We offer maternal fetal medicine, which is a group of highly specialized physicians who do this amazing work intrauterine. So they do procedures intrauterine to save babies and mommies' lives. Wow. And in fact, we're one of the few hospitals in the nation that provides some of the procedures that we provide. We have the only, in the local area, on-site midwifery program. So that's really special for our mothers because we get to offer them more services, right, that they would like. We also have postpartum, antepartum. So antepartum is the women who were pregnant, and we take care of those high-risk needs that they have to keep baby all safe and mommy all safe until it's time to deliver. We have GYNs, so we get GYN patients there. We also are affiliated, as you know, with the University of Tennessee. So we have all of those different groups, whether they're physicians, all levels of physicians, students, interns, fellows, nursing students, all of that, and all of us together take care of our moms and babies.
Wow, that's exciting, and thank you for what you do on behalf of all the moms and babies that come through here. We all, okay, I say we all. I was blessed to have, I'm blessed to have 5 healthy children. I take it back. Fathered 5 healthy children. And every time when I get the news that, hey, we're pregnant, you just imagine that it going 9 months and magically on the determined day 9 months later a normal healthy newborn pops out. That's not always the case in the ladies that you're taking care of over on Route Center. So, and there's a lot of emotional ties to that, and so you're dealing with women who thought the same thing my wife thought, and here it is at 5 months or at 4.5 months, and they're in labor. And how do you and your nurses work with them? Because that's more than just nursing. That's trying to help the emotional piece and then taking care of the baby on the other side. So tell me a little bit about how you help that and how you help recharge your nurses, because it's probably some trying times.
Yeah. You're correct. It's not true. The dream of you're pregnant and you're going to have this perfect baby and your whole course, and it's going to go the way you think, the birthing plan, the famous, infamous birthing plan. So, yeah, and I'm one of 6, by the way. I have a twin brother, and we were last. Yeah. So, anyway, yeah. So, you're right. It is a lot. There are a lot of emotions involved. It's extremely complicated, and our population is so complicated. So they're automatically coming in, set up to not go well. And so I think first of all, our staff are experts. They're really experts at what they do. They care. They're very holistic in their care. They listen to their mothers. They listen to the families. And so creating that environment where you feel safe, because there's a lot of fear,
right.
A lot of fear when all of that happens. And, COVID and not being able to have support people during COVID has been really hard, really hard. And so we've had to work especially hard. And not just fear for the patients, but fear for ourselves and our own families. And so as leaders, and as my route leaders, our nursing leaders and physician leaders, we really had to work together, as we always have, but even more so to communicate well, to be among. I wore scrubs a lot. Go in there, be among. Go in the patient's rooms when you can. When you can't, then find other ways to be among and be with. And a lot of it is being present. So yes, we have the clinical expertise. We really do. We're renowned for that internationally, so that's okay. But what is the most important is, and we have a diverse population, so a lot of non-English speaking. So how do we know what their birth customs are? So on the fly, we have to go to the internet real quick, and run into that room. And this birth mother doesn't speak English. She's been in America for 4 months. And really it was all about the grandmother is the one who leads the birth experience. And they also believe that in this particular case that the mother keeps warm. So we had to go quickly and get warm blankets and surround that mom. And I actually physically held the mother and stroked her head so she'd get an epidural, but she didn't understand. She was so afraid she didn't have her mother, and just kept, rubbing her head and saying, it's going to be okay. Mommy's here, mommy's here. So I became her birth mom to give birth. So those are the things that we do en route.
That's impressive. And I applaud you and your team for what you do, and you're also taking care of the NICU, where you were babies who are born prematurely or are managed, and you and your team do an excellent job with that. And so we're hopefully at the end of this pandemic, and as you said, the pandemic changed where you used to have to almost say, okay, we got to limit how many people are in here with mom while she's in labor, and send some of y'all to the waiting room, to where we can only have maybe one. Initially, it was none, and then we got to one.
Correct.
And so there was a lot of changes related to this pandemic. One of the changes, I hear you took over an area of the hospital that really nobody knows about, but unfortunately during the pandemic we used it more than we historically would. But you took a real interest in managing our morgue. Tell me a little bit about that.
I had a little bit of background in hospice, and so for me, it's just been the greatest joyful privilege probably of my career now to surround myself with birth and then death. And so I truly have my arms around everybody, right? And so to bring respect and to bring care and the decedent care has been really important. And I have a fabulous team with that too. Everybody thinks it's like CSI and that, morgues on TV. And that's not what as it turns out, any hospital I think in America has anymore, as I had to do my research, right? And so I have a team, and I have a business person who helps me run the fetal demise program en route, and then the house supervisors help me run the adult side of the morgue, and then a host of other people. And then with COVID, of course, policies, procedures, everything had to be looked at. The spotlight was then on the morgue because everybody was looking at New York, right? It's like, oh! So we couldn't let that happen. So we partnered in the community. At one point, body bags were on back order. You couldn't, we had to be able to expand our service. We had to expand our capacity in the morgue. So we had to pull in facilities. And what are we going to do? I had to reach out to local funeral homes. I called all the other places I've ever worked before. What are y'all doing? What are you doing? And so we worked. It was a collaborative effort to make sure that we were doing the right thing, which changed every other day, I have to say. As you know, and how to, even from postmortem care on the units, and then, of course, even being picked up, right, by the ME's office or the funeral homes. What did that look like? So it was a real opportunity to design, create, develop, or update maybe any other policies and procedures we had, and now it's all in place. And so one of the silver linings, I guess, of COVID, but to bring that attention and love and care to those that we did care for until they actually leave us.
And it's a little thought of, but when we talk about patient experience, we think of the patient in the bed, but that patient experience is their family. Mm-hmm. And unfortunately, when someone dies, that post-death experience now is the experience of the family. And when it's done with respect, and when it's done with poise, it doesn't look like, hey, we never done this before, what do we do? But you give that comfort to the family that you're also going to take care of their loved one in an appropriate way, even in death. So I appreciate you taking that on. I had an opportunity to go down there. We filmed a little video, and Lilly is responsible for putting a prayer on the door of the morgue that is ask everyone to recite that prayer before they place a deceased individual in there, and it was very touching, and it brought humanity to the dying and death process. So thank you so much for that. Segue a little bit here. Just that's the reality of what we do, but it's so important when we have this, the staff that you do, the talented people that you have, the complexity of what you do. How do you celebrate wins with your team? And do you feel that's important? And which I'm hoping you'll say yes. But do you feel that is important? And then how do you do it? And how do you make the teams happy to be a part of and feel welcomed and loved by their fearless leader?
Well, I hope I do that every day, every minute, every hour, because truly I do celebrate them. And again, back to being present, I think that's probably the biggest way we do it as leaders. So one of the things that we decided on in the management group is every day, Monday through Friday, not always can we have some conflicts, we get together now as leaders and we round on all the units and we be among, and sometimes we'll pick one unit, like the NICU's big, so we'll go all the way. I just onboarded a new manager, so we introduce that manager all the way around. We talk to the people, they see us together, we say thank you. We'll ask, please, PCC, identify the person who's really gone above and beyond today. So that's probably where I believe we let them know that we care the most. Also, if they ask us for something, this is also something I stress, we try to deliver it. If the staff asks for something they really need, mm-hmm. Do you have the tools and equipment? We try to get it. We send home thank you notes. We celebrate when they graduate from, an accelerated program, or, go from ADN to BSN, get a master's. We certainly have a lot of parties if we can. COVID has put a real glitch on that. So I'm looking forward, because I'm telling you, that Sharonda Taylor and Adrienne Walton, no one gives the party like they do on their unit. They celebrate everything. And I asked them, I said, my Lord, we're talking it's beautiful. And they said they learned it from a previous manager years and years ago, how to do it right. So, and then we have y'all come visit us and you tell us you're doing a great job as a team. We have the safety call. anything we can do. You get it?
I think I judged a chili contest one time.
Yes,
up
you
there,
did. We had a chili cook-off among the different service lines and departments, and that was really fun. And we dressed up.
Somebody
that's
that
right.
chili didn't win, so it was
so just know that that's coming back as soon as COVID's over, because that was a lot of fun.
Well, very good. Well, it's thank you for what you do. You bring such great positivity and energy to women's services, and you help that start of life process. And so from the bottom of my heart, on behalf of all the leadership and our board, we thank you. Before we close out, when you first came, you told me something that about you heard me speak somewhere, and that was one of the reasons. Help me with that, because it makes me very nervous when I go speak.
I knew Diana Topshin with the Studer Group when she opened up one of the hospitals in a previous system we both worked in. And so I'd known her for years and years, and then she went to work for the Studer Group, and so she was like, maybe you want to come work for the Studer Group. So she actually, I actually flew here to Memphis years ago, and she brought me to, they used to have LDIs, right? And to the LDI, it was actually over at UT, and you were talking about falls, and you were talking about falls and that fall rate, and you got off the stage and you were actually walking around and saying, you will lower your fall rate. Everybody hear me? And you were walking among, and I just went, okay, that's it. That's the guy. That's the one I want to work for. So way before, another nurse leader invited me to come and interview that. And I still say that today. Never even more happy that I heard, saw, listened, and came and was invited to come. So I want to thank you personally for being the man I thought you were, for being the leader that I thought you were. And one other thing I want to say, and it's on my door, on my office door. It's tough to beat a team that never gives up. Babe Ruth.
That's true. Thank you for that. Thank you, Lilly and Ambro, for bringing back Lunch with Dr. Coopwood, even though I don't see any lunch. But that's fine. We'll say we talk during lunch. And as we get back into the normality of running a hospital, we'll get these podcasts back on a quarterly basis. And we look forward to talking to more individuals in the organization, like we've had an opportunity to talk to both you and Ambro today. So thank you for what you do and being a part of it, and thank you for being here today.
Most welcome.